In today's video, we'll explore 7 potential stroke symptoms that may manifest up to a month before a stroke occurs. Despite being a leading cause of death, strokes often go unnoticed until it's too late, emphasizing the importance of recognizing these early warning signs. Age, gender, or health status don't exempt anyone from stroke risk, making awareness crucial for all. These pre-stroke signs, though subtle, shouldn't be ignored as they could indicate impending danger. Sharing this information with loved ones could potentially save lives. Understanding the differences between ischemic and hemorrhagic strokes is vital for timely intervention. Furthermore, we'll discuss brain aneurysms and their warning signs, along with transient ischemic attacks, TIAs, that serve as critical precursors to strokes. Even without symptoms, individuals with a family history of brain aneurysms should consider proactive screening. Ultimately, prevention is key. By staying vigilant and seeking medical attention promptly upon noticing any of these symptoms, individuals can significantly reduce their risk of stroke-related brain damage. Let's dive in. Discover now the 7 signs or symptoms that can occur a month before a stroke. If this happens to you, seek medical attention as soon as possible. Number 1. High blood pressure. Persistent high blood pressure, medically known as hypertension, is a critical risk factor for strokes, underscoring the paramount importance of effectively managing this condition. Blood pressure, which measures the force exerted by blood against artery walls, becomes a significant health concern when it remains consistently elevated. This chronic elevation can inflict gradual damage upon blood vessels, resulting in their narrowing, weakening, or, in severe cases, rupture. Such vascular impairments significantly escalate the likelihood of strokes. In instances where high blood pressure triggers the rupture of a blood vessel within the brain, it can lead to hemorrhagic strokes characterized by bleeding. Similarly, hypertension-induced damage to the arteries that supply blood to the brain may impede blood flow or cause obstructions, precipitating ischemic strokes. Effectively managing hypertension necessitates the adoption of a healthier lifestyle, including dietary modifications, regular exercise, stress management, and adherence to prescribed medication regimens. These proactive measures are not only instrumental in reducing the risk of strokes, but also in safeguarding against other cardiovascular diseases. By diligently controlling blood pressure levels, individuals can substantially mitigate their susceptibility to stroke-related complications and enhance their overall cardiovascular health. Number 2. Excessive fatigue. Excessive fatigue, characterized by extreme tiredness, can serve as a warning sign or symptom preceding a stroke. It's crucial to note that fatigue can stem from various causes, but if you experience intense and persistent tiredness that deviates from your usual fatigue patterns and is unrelated to physical exertion or inadequate sleep, it warrants attention. This heightened fatigue might signal underlying changes in blood flow to the brain, potentially attributed to arterial narrowing due to atherosclerosis or the presence of a clot, which disrupts oxygen supply. Seeking medical evaluation for abnormal fatigue is imperative, as it could be indicative of an impending stroke. In some cases, extreme fatigue may precede a transient ischemic attack, TIA, a temporary disruption in the brain's blood supply. TIAs act as crucial warnings, signaling a heightened risk of stroke. While TIA symptoms mimic those of a stroke, such as temporary numbness or weakness, they typically resolve within hours without causing permanent brain damage. This rapid symptom resolution underscores the urgency of seeking medical attention. The temporary blockage of an artery in the brain during a TIA resolves within 24 hours as the body successfully dissolves the clot, known as a thrombus. However, the occurrence of a TIA serves as a clear indication of heightened stroke risk. Therefore, individuals experiencing transient signs or symptoms should prioritize seeking immediate medical attention to mitigate the risk of a full-blown stroke. Being vigilant and responsive to these warning signs can significantly enhance the chances of preventing stroke-related complications. Number 3. Changes in vision. Sudden changes in vision, such as blurry vision, double vision, or difficulty focusing, can indicate circulatory damage in the brain and serve as warning signs of a stroke. Vision problems should not be overlooked, as they may result from the blockage of an artery supplying blood to the eye, often indicating an ischemic stroke, the most common stroke type. Prompt medical evaluation is crucial when experiencing such changes to mitigate the risk of stroke-related complications. Number 4. Sudden and severe headache. A sudden and severe headache can precede a stroke, but it's important to recognize that not all headaches are stroke-related, and not all strokes are preceded by headaches. In ischemic strokes, the headache arises from the obstruction of blood flow in the brain, described as severe and abrupt. Conversely, hemorrhagic strokes, characterized by brain bleeding, lead to intense headaches due to increased intracranial pressure. Witnesses often observe the affected person clutching their head in agony, followed by loss of consciousness, particularly common in hemorrhagic strokes. Severe headaches may also signal an imminent risk of a brain aneurysm rupture. Prompt medical attention is crucial when experiencing such symptoms to prevent potential stroke complications. Number 5. Numbness or weakness. Numbness or weakness in body extremities, particularly on one side, can signal an impending stroke. These symptoms may occur during a transient ischemic attack, TIA, characterized by temporary reduced blood flow to a brain region. Typically affecting a single body part, such as an arm, leg, or one side of the face, this sudden numbness or weakness leads to decreased sensitivity. While symptoms may last only a few minutes to hours, they should never be ignored, warranting immediate medical investigation. Whether indicative of a stroke or another neurological issue, prompt attention is essential to prevent potential complications. Number 6. Speech problems. Before a stroke, individuals may experience sudden difficulty speaking, characterized by slurred speech or challenges articulating words. This condition, known as aphasia, involves impairment in understanding, formulating, and expressing speech. Recognizing these speech problems is crucial as they indicate a potential stroke onset, prompting immediate medical attention to mitigate complications. Number 7. Neurological problems. Individuals who are on the brink of experiencing a stroke, whether it's hemorrhagic or ischemic, may exhibit a range of neurological symptoms. These can include memory issues, loss of balance, as well as nausea and vomiting. Importantly, these symptoms may manifest a few days or even weeks prior to a cerebral event, serving as crucial warning signs. However, it's imperative to recognize that various other conditions, such as migraines, seizures, hypoglycemia, brain tumors, anxiety attacks, and infections in the central nervous system, can also elicit similar symptoms. This complexity underscores the importance of a comprehensive medical evaluation to accurately diagnose the underlying cause and provide timely and appropriate treatment interventions. It is crucial to consult a qualified doctor for a comprehensive evaluation to accurately determine the cause of symptoms indicative of a potential stroke. Understanding the difference between an ischemic stroke, ESIC, and a hemorrhagic stroke is essential in recognizing and responding to stroke-related symptoms promptly. An ischemic stroke occurs when there is a blockage in the blood supply to a part of the brain. This blockage can be caused by a blood clot that forms elsewhere in the body and travels to the brain, or by the formation of plaque in the brain's arteries. A common condition contributing to clot formation is atrial fibrillation, an abnormal heart rhythm that disrupts blood flow and increases the risk of clot formation in the heart chambers. These clots may then travel to the brain, causing an ischemic stroke. Atherosclerosis, characterized by the accumulation of fat and the formation of plaque in the arteries, can also obstruct blood flow to the brain, leading to an ischemic stroke. This type of stroke is the most common, representing 85% of all cases. On the other hand, a hemorrhagic stroke involves the leakage of blood into the brain due to the rupture of a blood vessel. This occurs when a blood vessel in the brain bursts, causing blood to spread to areas where it shouldn't be. The leakage of blood can increase pressure and damage surrounding brain cells, resulting in various complications. Both types of strokes are serious medical emergencies that require immediate attention to minimize future damage. A common cause of hemorrhagic strokes is a cerebral aneurysm, which is an abnormal dilation in a brain artery. While many cerebral aneurysms are asymptomatic until they rupture, some individuals may experience signs such as headaches or neurological symptoms. Prompt medical evaluation is necessary if a cerebral aneurysm is suspected to prevent rupture and subsequent hemorrhagic stroke. Detecting a brain aneurysm involves specific diagnostic tests such as CT angiography, MR angiography, or cerebral arteriography. These tests help determine if the aneurysms are at risk of rupturing and if treatment is necessary. It is essential for individuals with a family history of brain aneurysms to undergo investigation to assess their risk and take appropriate preventive measures. Preventing strokes involves various lifestyle modifications and medical interventions. Controlling blood pressure, managing diabetes and blood glucose levels, maintaining a healthy weight, and regular exercise are essential preventive measures. A balanced diet rich in fresh and healthy foods, avoidance of processed foods, excess sugar, saturated fats, and excessive alcohol consumption can also help reduce stroke risk. Additionally, quitting smoking, ensuring adequate sleep, controlling cholesterol levels, and staying up to date with medical checkups with a cardiologist are crucial steps in stroke prevention. In conclusion, recognizing the signs and symptoms of stroke, understanding the differences between ischemic and hemorrhagic strokes, and taking proactive measures to prevent strokes are vital for maintaining overall health and well-being. It is essential to prioritize stroke awareness, share knowledge with loved ones, and seek medical attention promptly when symptoms arise to minimize the risk of stroke-related complications. If you find this video useful, please like and subscribe. Thank you for watching.